Okay.
Hi everybody, welcome back to my channel. In today's video we're going to talk about men and eating disorders. If this is your first time here, please subscribe and hit the notification bell. Did you know that 25% of all people who have the eating disorder are male? If you'd like to know more, please stay with me. I'm the Comfortable Counselor. Put your feet up, relax, let's do this. For a long time, females were the only ones who were considered to have the eating disorder. Males weren't even on the grid for that matter. Actually, if you'd like to know that children all the way to grown men can have an eating disorder. The problem is that not a lot of attention was given to males about eating disorders. Reasons include omission from research. All the studies that were done up until about 1972 did not include men. Okay? Only very few, maybe like 1%, they were even considered as being part of a study. Also, lack of recognition of symptoms. Men themselves did not realize they had an eating disorder. Family members of men could not see or recognize any symptoms of having an eating disorder. Bias of professionals, even at that level, it was not on their grid, so to speak. They just never considered a male having an eating disorder. That makes no sense. So they only focused their studies, their attention, and their care only towards females. Of course, let's go back to the stigma, right? The whole thing with mental illness and stigma is a great umbrella, I guess, of problems in regards to mental illness. But then you have men. Men are less likely, as you know, to get help. And then to eating disorders, the stigma is even worse. There's no way a man is going to go to a center or a doctor and say, "Doctor, I have an eating disorder," okay? Because men just don't do that because they think it's a female disorder, right? A lot of times, until recently, the centers for eating disorders, the treatment centers, they wouldn't even allow guys to even go in there. They were literally excluded. No, you cannot come in here. You are not a female. So also, when they were allowed to go to these treatment centers, mostly it was geared towards women. The programs, I mean, things like wallpaper, the pictures, everything was literally branded towards just women. So, also, symptoms are different for men than they are for women. Again, if you can't recognize the symptoms in the first place, then you aren't going to know you even have an eating disorder. There's been a lot of progress, I'm happy to say, since way back when. You would not believe this, that one of the criteria to have an eating disorder was to have no menstrual cycle whatsoever. That was a criteria for having an eating disorder. So can you imagine a man saying, I don't quite fit into that criteria, so yeah, of course, you're going to be excluded. Did you know that male eating disorders are not new? 1689, the year 1689, there was a reported case of a man having nervous consumption of food. 1874, someone or several men actually were diagnosed with anorexia nervosa. So, it's not a new thing, and like I said, up until about 1972, men were not recognized as having an eating disorder. So, now a lot of experts will say that the amount of men who have an eating disorder range in from 20 to 25% of all people who have an eating disorder. However, the National Association of Males with Eating Disorders say 25 to 40% is most likely the case when it comes to the amount of people who have the eating disorder. Binge eating is most common when it comes to men. Yes, anorexia nervosa. Yes, bulimia nervosa. But binge eating is by far the most that men will suffer with. It is estimated that 40% of all people, okay, who have an eating disorder, usually binge eating is the main culprit. Now, it's important to know there are major differences between men who have an eating disorder and women who have an eating disorder. One, males tend to be older. Men typically have greater rates of mental illness. It's anxiety, depression, bipolar, things like having a personality disorder also will contribute to having an eating disorder, as well as they engage more in suicidal behaviors. They have a higher rate of being previously overweight. They are less likely to purge. Now, what also is very important to understand and recognize that men are more likely to compensate with exercise, right? They are tending to be more in the gym, spending more time there. They're lifting weights, they're doing cardio. That is their big thing, is the exercise. And unfortunately, males are less likely to seek treatment. And if they do, because they have stigma to worry about, because they are less likely to recognize the symptoms, well, they're entrenched in the eating disorder a lot longer. So therefore, guess what? They're a lot sicker when they come to the doctor. So that is something that's very concerning for me as a therapist, that these men are not getting the help that they need because they are delaying the help that they need, either because of stigma or because they don't know in the first place, which is why, again, I'm making these videos. So what is the cause of men having their eating disorders? Well, a lot of researchers believe that societal pressures, social media, in fact, we have this idea of how a man should look. We see the magazine covers, we see all the Instagram photos, we see a lot of images of men. They look happy and they look perfect and they're just chiseled and they're ripped. So a lot what happens is we see this ideal image, okay? Just like we hear about females and their eating disorders, they see an image that has been portrayed somewhere in the media and we think, wow, they must be happy. They're that size and they have the cool clothes, etc., etc. So a lot what happens is men, instead of us wanting to be thinner, we want to be bigger, right? So it's called muscle dysmorphia. It's a type of a thing called body dysmorphia. It's in the DSM. It's a real diagnosis, but we're kind of breaking it down to a subcategory where men want to be bigger instead of thinner. And why? Again, because we see these images of men who seem to have it all because they have the body that's just like ripped, right? And I'm impressed. I think they're great, but at what price do we pay to have that size, that look, those types of muscles that I think most times really are unrealistic? So we don't want to be thinner, we want to be bigger. So be careful when we're looking at images on the TV, videos, pictures, etc., etc. So what happens when we get that image in our mind? Well, again, we go back to compulsive behaviors, a lot of exercising, all the protein powders, the supplements, the extreme diet restrictions, pills, potions, shots, whatever you want to call it. We have those things at pretty easy to get, right? And so we take those things hoping that if we do A, B, and C, we're going to get that body so we can get that job, get that girl, get that whatever, so we can feel good about ourselves. We have to be careful. That is not the path to happiness. Now, it's really important that we dispel a myth about men and eating disorders. A lot of people have thought over a long period of time that it's only those men in the gay community who have an eating disorder. That is so not true. It's not men in the gay community. It's not just a female disorder. Yes, there was a study done back in 2007 that showed that a lot of gay men were suffering from anorexia nervosa. But that was just one study a long time ago. The truth is, the majority of the men who have an eating disorder, they're heterosexual. That's right, heterosexual. So that is very important to know, that nobody has any kind of judgments. Again, we cannot continue to perpetuate the stigma ourselves about our own mental health. We have to raise the awareness. We have to crush. We have to break the stigma. Other studies that have shown about eating disorders, it all has to do with really sometimes just your gender identification. If you identify as a male, then you're more likely to want to be bigger. If you identify as a female, you're more likely to want to be thinner. Now, unfortunately, there is not a male-specific type of treatment for eating disorders. However, they do respond well for those strategies that have worked also with females, which is great. Things like cognitive behavior therapy and family-based treatment for adolescents especially and young adults work very well, especially those who have, again, that whole muscle thing going on, which is called muscle dysmorphia, where they think that basically they look in the mirror and they think, I'm not big enough. They check the mirror again a few days later, not big enough. A month later, I'm not big enough. So there is a definitely distortion in how they see themselves. Again, it's called muscle dysmorphia. So that type of treatment works well for those who see themselves as not big enough. And along the same lines, what you want to do is limit things like your protein shakes, all that protein that is so important for muscle building. Start limiting that. start limiting the amount of exercising that goes on, because that can be such a compulsive behavior by always going to the gym, always making sure that they're going once, twice, 3 times, 4 times a day even. So that's very important to look at. What we want to do, again, is we love our women. We are right there with them, alongside them, especially when it comes to mental health. But we want to erase the stigma that it's not just a female disorder. Guys, we have those same types of disorders. And we can do this by raising the awareness and erasing the stigma. The last thing I want to mention is there is help. Either for you, if you're a guy watching this, if you're a loved one of someone who you are concerned about, there is help. What I'm going to do is I'm going to put some links in the section below. Okay, so please look at those. Those are great resources to help with eating disorders in general. Also, there are specific ones just for guys. Again, I want to help. I want to be part of the process. I want to be able to help to raise the awareness, erase the stigma, so we all are in this together and figure out a way to get better. I hope you all have gotten something positive from this video. If nothing else, please remember, this is your life. This is your story to write or rewrite as many times as you want. Check out my videos every Sunday. This is The Comfortable Counselor. Have a great week.